And welcome back to Healthy Living Live. You see the sign. We're at the Immediate Care Center. Tyler Village is the name of the little operation we're in front of here. We've got a Kroger next to us. You know where it's at if you live in the area. And it's all about men's health today. Jackie, you have another expert. I love this information, especially when it comes to us weekend warriors.
Exactly. Dr. Sam Carter is a specialist in sports health with Norton Healthcare. In fact, we have a whole area of sports health at Norton Healthcare. Dr. Carter, obviously, there are many benefits to staying active and staying healthy, but sometimes you really have to convince people to get up and move, especially when 1 in 3 people today is obese.
That's right. I think staying active is probably the most important thing you can do for your joint health overall. Keeping the muscles strong around your joints is one of the most important things. Even with an arthritic joint, it's very important. And not only that, but it has other health effects as well. You know, keeping your weight down has more than just musculoskeletal benefits. Obviously, cardiovascular being the most important.
Do you see part of in sports health are the injuries the main issue that you deal with? Things because people go at it too hard, too strong, and then come in like John was talking, the weekend warrior with an injury.
Right. I think that's probably the most common thing I see in my office is, an acutely injured athlete. Now, it could be an acute injury or it could be an overuse injury. You know, we did a lot of coverage, medical coverage for the races this year, and so we saw a lot of overuse type injuries in that scenario. But we also in sports health try to focus on injury prevention as well, and that's not really something we get to see in the office, but we try to get out into the community and make that known that there are ways you can help prevent some of these injuries too. And
you've got a large audience right now. Why don't you tell us about some of those ways that we can prevent sports-related injuries?
Sure. Well, what we've tried to do is we've partnered some with the Jefferson County school system. We have some trainers through Court Physical Therapy that are out in some of the schools providing coverage for all their sporting events. Football is the one that we typically think of as having the most acute injuries, but really all the high school sports have a high rate of acute injuries. So having a trainer on the field is very important. We also have physicians there for most of the football games when we can. So helping just being there when there is an injury. And then we're looking into starting some programs that can help prevent some of the more serious injuries, specifically ACL injuries. That's a special interest of mine. So we're hoping to implement soon some injury prevention programs or protocols in some of these schools to hopefully reduce that number.
I think I was reading about a study in particular about young women athletes and more ACL injuries, like playing field hockey or lacrosse. Are you seeing that as well in your practice?
Yes, definitely. Young females are much more at risk for an ACL injury. The causes are multifactorial. No one's exactly sure what the most important reason is, but there are many factors that lead to that. But there may be 2 to 3 times more at risk for an ACL injury.
And what do you think some of those factors are? I'm just curious.
Some of it is musculoskeletal. The pelvis is different in women. The pelvis is wider. The knee angle is a little different. Some of it is a training issue. Muscle strengths are different. Some of the females participating in some of these sports don't have the muscle development they need in the thighs and the legs to handle some of the forces that they're going to see. And then there are many other factors. Even hormonal factors have been thought to contribute that can weaken the ligament actually.
If you strengthen the muscles with these young women, could that help prevent some of these ACL injuries and other injuries based on their usage?
Well, that's what we believe.
We hope.
Yeah, we believe that. There's been several pilot programs looking at specific training programs. Basically, they're warm-ups before practices and games, working on specific balance and muscle exercises. And they have shown some early promise in reducing the number of these injuries.
That's great.
You know, I'm familiar with the Kentucky Orthopedic Rehab Team. You were talking about your partnership with Court. I would think your industry right now, for those who are interested in the medical field, is really booming and growing. As they hear the expressions, the 50's the new 40 and 60's the new 50, etc. So people are exactly, and we're trying to stay more active. So therefore, someone like you, hey, we need you.
Right, yeah, I think definitely the population as a whole is more active at an older age than they used to be. Now, we touched on it earlier, there is a significant portion who are not active at all and who are ending up with some problems as well. And I see both of those in the office, but through the sports health program specifically, it's those people that are still active at any age, and you are more prone to injury when you get older. I mean, it's just a fact. So we do see a lot of those people, and it's kind of fun to take care of those people.
Oh, we're glad that you enjoy it. Dr. Sam Carter with our sports health program at Norton Healthcare. A lot of things going on there. And we've got a special program coming up Tuesday, June 19th from 6 to 7 p.m. and we call it Step Away from Foot and Ankle Pain. Dr. Philip Dripchak is going to be doing that. A great guy did a story on him, and you can find that on my blog page at nortonhealthcare.com, and he's going to be talking about how to prevent foot and ankle injuries. It's at Norton Audubon Hospital in the community room, lower level 12. And something else, we're here at the Immediate Care Center off Taylorsville Road in the Gene Snyder, but we have 12 immediate care centers, and the one in Okolona is a little bit unique in that they also have some pediatricians on staff after hours when your regular pediatrician might be closed. So that's a resource for you. The Okolona Immediate Care Center has pediatricians nights and weekends if you need a pediatrician. It's not an emergency. It's just something you need to go in there and check and see something's going on and I need somebody to check out my child.
Good information from both of you, Dr. Carter and Jackie Hayes, Immediate Care Center, Tyler Village. We'll be right back. Healthy Living Live.